Welcome to Medical Specialist Associates educational series on topics in pain medicine. I'm Christopher Voss, MD, MS, FCCP, board certified in anesthesiology and pain medicine. Today we'll be discussing geniculate nerve blocks and whether they might be the right option for managing your knee pain. We'll also explore when it might be appropriate to consider progressing to radiofrequency ablation, RFA, if you respond well to these blocks. What is a geniculate nerve block? A geniculate nerve block involves the injection of a local anesthetic around the nerves that supply sensation to the knee joint. The goal of this procedure is to provide pain relief by temporarily disrupting the pain signals transmitted from the knee. When is a geniculate nerve block recommended? Geniculate nerve blocks are primarily recommended for managing knee pain associated with the following conditions. If you have osteoarthritis, which is chronic knee pain due to degeneration of the knee joint, and conservative treatments have not provided adequate relief. Persistent knee pain following knee surgery, including total knee replacement. Knee pain that has not responded well to physical therapy, medications, or other interventional procedures. If you are considering the procedure, what can you expect? The procedure is typically performed on an outpatient basis and involves the following steps. You will lie comfortably, and the skin over your knee will be cleaned and numbed with a local anesthetic. Using imaging guidance, your physician will insert a needle near the geniculate nerves and inject the local anesthetic. After the injection, you'll be monitored for a short time before being allowed to go home. You may experience temporary relief in knee pain immediately after the procedure. What is the probability of success and duration of relief? The effectiveness of geniculate nerve blocks can vary depending on the underlying condition and the severity of your symptoms. What are the success rates of diagnostic geniculate nerve blocks? Studies suggest that diagnostic geniculate nerve blocks provide significant pain relief in about 60 to 80% of patients, indicating that these patients may be good candidates for RFA if the pain relief is substantial but temporary. What is the duration of relief? Pain relief from a geniculate nerve block can last from a few weeks to a few months, particularly when steroids are used in addition to local anesthetics as part of the diagnostic nerve block. If the pain relief from the block is substantial but temporary, this may indicate that RFA could be a good next step for more prolonged pain management. What patients might consider radiofrequency ablation? If you experience significant pain relief from the geniculate nerve block, you might be a candidate for RFA. RFA is a procedure that uses heat to create a lesion on the nerve, which can provide longer-lasting pain relief by disrupting the pain signals more permanently. How is RFA performed? The RFA procedure is also performed on an outpatient basis. Similar to the nerve block, you'll lie comfortably, and the area will be cleaned and numbed. Using imaging guidance, a needle is inserted near the geniculate nerves of the knee. Radiofrequency energy is then applied to create a controlled lesion on the nerve. You will be monitored after the procedure and may go home the same day. The full effects of RFA may take several weeks to develop. What is the probability of success and duration of relief with RFA? Studies show that RFA can provide significant pain relief for about 60 to 70% of patients who had a positive response to the diagnostic nerve block. What is the duration of relief with RFA? The pain relief from RFA can last between 6 months and 1 year, with some patients experiencing relief for even longer periods. It's important to note that the nerves treated with RFA can regenerate over time. This means that the pain may eventually return, but the procedure can be repeated if necessary. Can you have a knee replacement after these procedures? Yes, you can still undergo a knee replacement even if you have had a geniculate nerve block or RFA. These procedures do not interfere with the ability to perform a knee replacement surgery in the future. Additionally, if you have already had a knee replacement but continue to experience knee pain, you may still be a candidate for a geniculate nerve block or RFA, depending on the nature of your pain and your overall health condition. Potential complications and risks. Like all medical procedures, geniculate nerve blocks and RFA carry some risks, although serious complications are rare. Short-term side effects include temporary increase in pain at the injection site, temporary numbness or weakness in the knee. Long-term risks include infection at the injection site, which is rare, nerve damage, very rare with both procedures. What are the goal outcomes and other considerations? While geniculate nerve blocks and RFA can be very effective for managing knee pain, they are typically part of a broader treatment plan that may include physical therapy, medications, and lifestyle modifications. It's also important to remember that not all patients will respond to nerve blocks or RFA in the same way. Some may experience significant relief, while others may have minimal or no improvement. Geniculate nerve blocks are generally considered a temporary solution. If you achieve pain relief, it can be an opportunity to engage in physical therapy and other treatments that address the underlying causes of your knee pain. If you respond well to the nerve block but the pain returns, your physician may recommend RFA for longer-lasting relief. Deciding whether a geniculate nerve block or RFA is right for you should involve a thorough discussion with your physician. Together, you can weigh the potential benefits against the risks and consider your specific medical history and treatment goals. Understanding the indications, potential benefits, and risks can help you make an informed decision about whether these treatments are right for you. To learn more about managing knee pain, please visit our website at medspecialists.net and subscribe to our YouTube channel.